What's up, family? Today we have some breaking information regarding our seniors, in which they are now allowed to receive up to $3,000. This has been possible because of the new assistance program for those who need it the most. Also, we have new changes for the January SNAP recipients. We now have information from the mayor saying that he will approve of additional EBT benefits. I have the details to share with you in just a moment, but before we get started, make sure that you're subscribed to the channel as well as hit the like button for the YouTube algorithm. Now let's go ahead and start with the video. Starting off, I do want to go ahead and give you a little bit of an update in regards to what the hospitals are doing right now. Yes, they are bringing back some of the mask mandates that we saw during the episode of the pandemic. And this is now because of the new respiratory viruses that are continuing to surge in different states as well as different countries. Again, hospitals are beginning to revive those mask mandates as the highly contagious COVID-19 variant known as the JN.1 is overspreading the United States, and health systems are trying to grapple with the spike in other seasonal respiratory viruses. There are almost 35,000 COVID hospitalizations across the country for this particular week, from December the 30th till now, a 20% increase. And yes, some of the things that they're detecting is that flu cases are surging up to 17.5% from the previous week. Healthcare facilities in New York, California, Illinois, Massachusetts have all made mask mandates required for their patients as well as their providers. And also, according to the NYC Health Department, plus the hospitals in New York City, they have imposed a mandate at its 11 public hospitals, as well as clinics and nursing homes, particularly to protect the staff as the cases continue to rise. So are we on the verge of going through another pandemic very soon? Well, this sure sounds like it when you tell us that hospitals are the first ones to start making it mandatory to start wearing a mask again. Are we going to start seeing retail stores, grocery stores, large facilities during the beginning of the school year? So anyways, we will have to keep an eye on this as these continue to surge in multiple different areas. And we definitely want to look towards what the CDC has to say, but obviously take that with a grain of salt. But then we also want to see what these particular locations are doing. I know specifically it said right here, these particular states, but are these Democratic states that are actually doing this versus Republican states as well? We'll have to make that decipher. But I know New York specifically and California are definitely Democratic states. So anyways, like I said, we'll just have to continue to follow this and hope that we are not on the verge to moving down that path of everyone having to wear a mask all over again. Would you guys want that? Comment down below and let me know that you do not want us to go down that path once again. But anyways, I do have some good information in regards to our seniors, our most vulnerable Americans in this country. And it says that seniors typically don't make much money since they don't have as much options to make money. This makes it very difficult to take care of them and other requirements and obligations. Senior assistance programs like the Supplemental Security Income, or better known as the SSI, and others described in this particular article are provided by the government to address these sorts of issues. Check it out right here. It says that $3,000 each for seniors. A lot of us think that our retirement time as a chance to enjoy and indulge in things like hobbies, trips, luxury purchases that we didn't have time or money for when we were much younger because we were working just to keep food on the table. But the cost of keeping up, even the basic standard of living, does not go down as one approaches retirement age. The average couple in their 60s is expected to require at least $600,000 for their medical costs. Did I read that right? $600,000 just for medical costs? That is insane. Yes, here it is right here, guys. For those over the age of 65 years old, there is a senior assistance program that offers up to $3,000. These programs often provide a range of assistance, including financial support, medical assistance, and housing assistance. These initiatives aim to improve older people's quality of life by providing assistance with the healthcare, housing, financial management, and their social needs. The specific assistance you receive may vary depending depending on the program and its organization. Making ends meet in old age can be very difficult since the average senior receives around $1,709 in Social Security payments and has no other sources of income. Fortunately, a lot of senior assistance programs actually exist in the United States that can help you or help people, seniors, given an additional $3,000 or more to lessen some of the burden. We have this particular paragraph right here that says that do you qualify for this senior assistance program? Seniors who want to receive $3,000 senior assistance program 2023 payment must confirm their eligibility. Seniors 60 years of age and older are eligible to participate in this senior assistance program, and they may only be received by those who have reached retirement age. How can the program assist needy seniors? Well, here are the specific programs right here, guys. Yes, we're talking about $3,000 senior assistance program can support seniors with meeting their basic requirements, including access to housing, affordable health care, food and money or other necessities. Yes, check these programs out right here. The first one on the list is Social Security retirement benefits. These are available to seniors who have contributed to the program for at least 10 years and are 62 years of age or older. Your monthly benefit depends on how much you've actually contributed to the Social Security Trust Fund throughout your time working in the United States. We all know that some people are suffering right now because they feel like Social Security is just not enough, and that is exactly why you need to look at other programs that are helping our Social Security seniors to help them soften the burden a little bit. So anyways, that is the first program that we already know about very well. The second program is that the Supplemental Security Income, or better known as the SSI. If you are at least 65 years old, blind, or crippled, you may be eligible to receive a cash payment called the Supplemental Security Income, or SSI payment. To be eligible, you also need to have little money and resources. So not a lot of money in your bank account, basically no money, because that's exactly how they look at it. But if you qualify, the most you can receive as a person is around $943 per month, and a couple can receive up to $1,415 per month. So that is the second program or assistance program that is available to our seniors. The third one on the list is Medicare. The purpose of Medicare is to assist those 65 and older, covering the cost of medical treatments for medical services and supplies. Original Medicare pays the majority of your expenditures. Medicare enrollees' eligibility for benefits is based on their earned income and any additional income or help that they may receive. Enrollment in other health insurance plans is possible, including the MSP that provides coverage for prescription medicines, vision, and dental care, among other benefits as well. So that is the third assistance program for our seniors. And then the fourth one on the list is Medicaid. The Medicaid program is there to cover a range of medical costs, including long-term care and nursing facility care. Seniors 65 years or older who are thought to have very low resources can access Medicaid benefits. People with impairments can also use it, and Medicaid enrollment is possible for recipients of SSI. So anyways, yes, we are talking about 4 different assistance programs for our seniors that could provide up to $3,000. A lot of people are not even taking advantage of either of these programs, and it's really sad because they could really use it, but a lot of people don't necessarily believe that they are eligible for it, and they don't necessarily feel like they can actually qualify to receive it, and so they don't even attempt to do it. But shockingly enough, more people are actually eligible than not. So if you do fit the description of either 65 years or older, and you are retired and you have worked within the United States, you could very well be eligible for one of these senior assistance programs. You definitely want to check them out as soon as possible, just to make sure, because you definitely don't want to turn down free money. So anyways, you definitely want to check that out. If you are interested, I will include this particular link down below in the description so that you can check it out in detail for yourself. Now, let's go ahead and talk about our SNAP benefits, because we have seen a few changes come out this particular week, and I want to share those real quick with you. The first on the list is that Instacart and Kroger are now teaming up, and they are now accepting SNAP benefits. This is going to affect our low-income citizens. SNAP benefits exist to bring nutritious foods when it otherwise would not be available. The federally funded program is called Food Share in Wisconsin. season, and it recently entered into a partnership to make it more accessible. Kroger, the owner of Pick and Save and the grocery delivery service called Instacart, will now allow food share recipients to use their benefits to purchase their products at the grocery store. So now you can actually use those and get them delivered to your home. So that is an awesome benefit, because a lot of times people that are on SNAP benefits receiving EBT payments every single month, they don't necessarily have the means or the car, or necessarily disabled. They can't necessarily get to the store. So Instacart is making a difference there, because they go and pick up the food for you at this particular store and then bring it to you to your front door. So anyways, you want to check that out if you live in the respective area. Also, we have the DC mayor. He recently agreed to give SNAP recipients additional benefits. As you can see, the director, Laura Zillinger of DC Department of Human Services, confirmed the temporary increase, saying that in part, while fiscal and administrative pressures still exist, this evening I have advised the mayor that the DHS will make this program work while we attempt to solve the ongoing challenges of food insecurity. Again, we are talking about DC. Mayor Muriel Bowser will give SNAP benefits additional funding, which avoiding a shutdown with the DC Council and a possible lawsuit. Right now, about 140,000 people in the district receive SNAP benefits, often called food stamps. Last March, families saw their benefits decrease after the pandemic relief funding ran out of money. So in order to fill that gap, they believe that they need to pass legislation that requires the mayor to use about $38 million to increase those benefits by 10% for 9 months if the district had a budget surplus. The district did end the last fiscal year with a surplus, but Bowser had not agreed to use that surplus for SNAP recipients until this past week. So anyways, that is some new information. They're going to use $38 million to increase the benefits for SNAP recipients. That is definitely some awesome news in the DC area. And last but not least, we do have some information in regards to the summer EBT program. That's pretty much going to pay out to eligible children during the summer time frame. I believe it is going to pay around $40 per month, or for the entire summer, $120. But anyways, Nevada has now made the summer EBT program permanent, so it will not be going away. We already knew that it was going to be here for 2024, but this new change is going to make it permanent forever in Nevada. So that is also some great news as well. But anyways, that is all I have for you today, and I hope all this information in this video was helpful to you today. Well, anyways, that's all we have for you today, but feel free to check out some of the items down below in the description. There are a couple of opportunities for you to earn some free money or some free cash, such as signing up with Webull, where they're giving away 12 free stocks after you deposit $1. The good thing about it is that those stocks can be worth around $3,000. And all you have to do is just sign up and use it for the first time. In addition to that, don't forget about getting the Amazon Prime membership. It's totally free. You can get it for 30 days, which is a great opportunity to be able to experience all of the benefits that Amazon has to provide, such as the NFL Network, getting your things delivered to your front door for totally free, and a whole ton of other items as well. So anyways, those links will be down below. But anyways, if you enjoyed today's content and you want to see more, please go ahead, subscribe to the channel. It's totally free. And if you like today's video, then go ahead and hit the like button for us. It really helps out this channel, as well as it tells YouTube to share this video with others. But anyways, I appreciate you guys stopping by and watching, and I hope to see you on the next video. Peace.